Resuming debate, the honourable member for Nunavut.
I will be sharing my time with the member for Vancouver East. As parliamentarians, we must recognize Indigenous-led mental health services. Colonial mental health services are not having the same effect for Nunavut as it may for other Canadians. Since time immemorial, First Nations, Métis, and Inuit have used their own practices to support each other. Our mental wellness practices as Indigenous people are valuable, but need more recognition. In Nunavut, community members do not have the specific spaces that provide secure and confidential mental health services the same way certified professional mental health providers do. The infrastructure may be there, but not available to Indigenous providers. If a psychologist was to travel to a community, they would leave people on a waiting list with little to no support. Practices that work for Southern communities cannot be the only option for Indigenous peoples. There are Indigenous-led services that are making a huge difference with the people they help. An Inuit mental health project funded by the Mandala Institute for Holistic Mental Health is beginning to offer Inuit-led services. This institute has a huge impact on Inuit across Canada. Inuit elders, activists, and advocates have long been calling for Inuit-specific mental health training programs. These programs need to be available to Inuit across Canada. Decolonized mental health programs are needed to address mental health crises that are leading to increased depression, addiction, and suicide rates. The Mandala Mental Health Funded Project is looking into piloting a Heal the Healer program. This program would train Inuit who support their communities with expertise in mental health. Projects like these need to be funded. There needs to be financial resources dedicated for Indigenous-led mental health practices. These services need to be recognized by the government to make sure the burden is not on Inuit. We cannot continue to ask Indigenous community members to volunteer their time and space because government does not recognize their expertise. This government allocated $600 million for innovative mental health care for Canadians since the start of the pandemic. There must also be a focus on providing funding for Indigenous traditional health practices. My communities are not seeing the support and training they need to support themselves. This is not acceptable, not in this time of reconciliation. We as parliamentarians need to demand more from this government and all future governments. We appreciate kind words, but significant investments for Indigenous-led mental health services are severely needed. As parliamentarians, we must stop placing the burden on Inuit and Indigenous peoples who do not have the housing, who live in poverty, and lack the infrastructure to do the work of the government. In the meantime, First Nations, Métis, and Inuit can access Hope for Wellness Hope Line at 1-855-242-3310. I have used them myself, and I am forever grateful for receiving counseling in Inuktitut from Help for Wellness.
Questions and comments? Questions et